Hi, everyone. Hopefully, we are live and I can see some people in the chat. Hello, Charlotte. Hello. I'm typing hello. Hello, everyone. Thank you so much for being here. Hey, Eva. Hey, is that Kira? Nitin? Thank you so much for coming. Hi, Sahini. Lovely to meet you. This is amazing. Thank you so much for spending some of your Saturday with me. Nice to see you too, Eva. Awesome. So today we are going to go through, hello, Sylvia. So today we're going to go through these 6 steps to get into medical writing. Thank you, Kira. Thank you for coming. Hello, Kofi, or is it coffee? Let me know. I'll wait for a few more people to come in because everyone is very excited in the chat, which is so lovely. So I'm loving the atmosphere already. So I'll give it one more minute and then we'll start officially. Awesome. I can see the chat the whole time, by the way. So if you do have any questions, I'll go through that in the beginning. But yeah, I'm super excited. So awesome. All right, give it one more minute and then I will start with the presentation. Hopefully this gray bar disappears. There we go. Okay, great. Awesome. Okay, so I'm going to start. Oh, hi, Irina. Hello. Thank you for joining us. Okay, here we go. Hi, I'm Virginia from Write Clinic. I'm also the founder of the International Medical Writers Association and the organizer, publisher, creator of Medical Writer Magazine. So today I want to thank you so much for joining me to go through the 6 steps to get into medical writing in 2026. So these are the 6 steps that we're going to go through. I just put a little map here that you're going to see pop up 6 times. And at the end, it's going to have all of the 6 steps mapped out for you. So before we begin, I do recommend that you turn off your phone, you close your other tabs, and you get rid of any distractions. And please do not copy and paste any links into the chat. If you'd like, you can grab your notebook and pen or have another window open to type any notes that you want to remember as well. You can also ask a chat question. So in the chat, you can ask a question at any time, and I look forward to your questions. So I just wanted to give a little AI statement. So no part of this presentation was generated using AI. So I didn't go to AI and ask it to create me a presentation or any part of anything that I've produced here. And I do not encourage the use of AI for writing or for image generation unless you have ethical practices, you apply critical thinking, and you also have respect for copyright and intellectual property. And you've also got privacy policies in place so that you're not leaking out confidential or proprietary information that could get you in trouble. So it's lovely to meet all of you. I've met quite a few of you already in the chat, which is amazing. So thank you again for coming. And so I wanted to just go through what my life is like as a medical writer right now. So at the moment, I do not commute anywhere. So I don't need to travel somewhere to be there for 9 o'clock and then travel back after 6 o'clock or anything like that. I work from home remotely, and I can also be paid to travel sometimes as well. I also work fewer hours. So I used to work from 9 a.m. to 7 p.m. Monday to Friday as a community pharmacist in London for about 6 or 7 years. And I also used to work weekends as well. And sometimes I look back and I can't believe I did that. And I was so tired. But also I was 5 years younger. So maybe I was able to keep up that way. But as you get older, you tend to value things differently. And so now I much prefer to have more time to look after myself. So whether that's cooking or going to the gym or hiking or simply just getting enough sleep or spending time with friends and family and maybe doing things that isn't work. So I have flexible hours to travel off peak and also book appointments. So I tend to get those weird hours that nobody gets at the doctor, like 11 a.m. or 2 p.m. at the dentist. And so that's quite nice to be quite flexible with that and not needing to ask permission to actually do that as well. And I also have more energy to read, build communities like this one, and also teach and create videos, which are things that I absolutely love to do. So, as part of my portfolio, I've worked with a number of brands and continue to work with them. So, some of the more notable ones are people like the World Health Organization, YouTube Health, the NHS, and also the London Clinic as the online doctor and Pharmacy Magazine as well. So, I wanted to go through also a little bit of a reality check and being honest with you, because I think a lot of people like the idea of medical writing but do not really think about the steps that it takes to get there, which is why I've created the 6 steps to get into medical writing webinar today. So just to be honest with you, medical writing is not a get rich quick career, but you can earn a comfortable living. So it's unlikely that you're going to be a millionaire. If that's your goal, then do something else, unless you want to create an agency, which is a lot of work in itself, and there's no guarantee for success as well. So I would say if you just want to have a job which is flexible and you have time freedom and you earn enough to be comfortable, which is what I value the most, then medical writing could be right for you. It's also quite competitive because the more people kind of learn about it, the more they understand that it's something they want to do. So it's a bit more of like a lifestyle career. So it really fits around your life. And it's perfect if you want to do something different. So if you also have kids, or if you're retired, or if you want to travel, or if you want to work from home, it's a very kind of flexible lifestyle career, as I said. And I would also say that if you do get into medical writing and you're lucky enough to get a full-time job, then these are perfect for learning skills. But they can be hard to get. And I've been made redundant twice over the past few years, but I am still thriving because first of all, I have a Master of Pharmacy degree, so I'm a healthcare professional, I'm a pharmacist, and I still maintain my registration as a pharmacist. So you can look me up on the GPHC register in the UK. And being a medical writer is just a way of taking the skills that I already know and applying it in a different way. So you have a lot of transferable skills if you are a healthcare professional or a scientist, or if you just really love writing, then there are still some opportunities for you to get into medical writing as well. And generally, medical writing is a skill for life. So if you learn how to write really well as a medical writer, maybe you can pivot from doing medical writing to other types of writing. So it's not a waste of time to learn how to write in general, because it's a very important foundational skill. And I would also say that if any of you are going to start asking about AI or artificial intelligence, I would say that it's not a threat right now. And also, I do moderate the subreddit r/medical writers. And actually, somebody made an interesting post the other day where they said that they're trying to figure out how to actually put AI into their workflow, but they found that really it doesn't save them that much time because they still have to check everything that it does. And so I would always recommend that you diversify your skill set. So if you do want to learn about AI and prompting and things like that, then that is something I mention later in the 6 steps. Oh no, I'm going to start giving it away now. So you do want to future-proof your career. So you might not do 100% medical writing to start with. You might start with editing or proofreading or something like that. And then slowly you'll get more and more into medical writing. So I would say the hardest part of medical writing is actually finding clients, but you only need a few to get started. And in this 6 steps webinar, I will show you kind of my top tips on how to do that. So just wanted to give you a little bit of an overview of some of the work that I've done over the years. So hopefully it can inspire you, but also give you ideas of what a real medical writer has been doing for the past 5 years. So I was 6 or 7 years as a pharmacist before, and I've been a medical writer and content creator since 2020. So one of the things that I first started working on was health condition pages for websites like the London Clinic, which is a hospital in central London. And I think it serves the royal family sometimes as well. And so I would say that one of the easiest ways to get into medical writing is actually trying to find websites like this that might need your help to write pages for them, because they're running a service at the end of the day. And so they will need content. And that content needs to be accurate, especially if it's medical content, because that will help to build trust with the people who are going to be looking at the website. And then also that could encourage them to then book an appointment. So this is a condition page about acne that I worked on the London Clinic website, where we had to review about 400 pages of content. And I trained a collection of writers to help me review the pages or rewrite them or write new ones. And then we also won an award for being a user-friendly website. So our content is easy to understand and the website is also easy to navigate, which is a great, what they call, user experience. So people who use the website can actually get the information they need and then possibly make an appointment. Another thing that I worked on was the Asda Online Doctor by Zava website. So this was completely secret back in 2021. And so we had to work on 150 pages for this. And one of the pages I worked on was Cerazette, which is a contraceptive pill. And so again, I had a team and we were working on completely brand new pages because this website didn't exist before. And during that time in 2020, 2021, there were online doctors that were trying to establish themselves. And so they needed content. And so there was a big drive for medical writers. And so if you were able to write quickly and write a lot, then they were probably going to be knocking on your door as a medical writer. And so this is work I did as part of the agency that I was at the time. Another piece of work that I've done recently is over the past year, I have been doing medical and accuracy reviews for the NHS.uk website. This is an example of what the top of the brief looks like. I can't show you the whole thing, unfortunately, but it's just to give you an idea of the kind of topics that I would work on. So they are really big topics, things like dandruff, and I would spend a few hours reviewing each of the pages just to check that the evidence matches up to what is currently acceptable. And so it was quite interesting to understand where the NHS.uk website gets its sources of information, because usually everyone uses the NHS.uk website as the source of information itself. So when you go beyond the NHS.uk website, you do need to look at other government documents and other publications from trusted sources. So that was a really interesting learning experience. And I got that work through Economist Impact, actually. So I've also worked on kind of learning materials for pharmacies as well, which was really nice. And so I worked on the content for Solpa Extra, which I think is a dissolvable paracetamol and codeine tablet. And this was actually for pharmacies in Ireland and then later adapted for pharmacies in the UK, I think. And this was through an agency. And through the same agency, I also worked on some helpful leaflets to show the effectiveness of Beckinase, which is a steroid nasal spray for allergies and also sinusitis and congestion. And then also the pain code. So talking about different ways to handle pain for people as well and how to safeguard customers. So I've also been featured in a few things. So I was featured as a healthcare SEO expert on the RFs blog. So RFs is a search engine optimization tool where you can find keywords to actually then target on websites and things like that. And it's really important to know SEO as a medical writer. I'll include it later in the 6 steps. And so this was a really great kind of breakthrough moment for me last year, where I was recognized as an expert in healthcare and specifically in SEO. So you can actually go and read this blog, which gives you 7 strategies about healthcare SEO. And I also worked with the WHO, which is the World Health Organization. So I produced a video for them last year in November for the antimicrobial resistance awareness campaign. So in November, there's an AMR, which is antimicrobial resistance awareness week. And so I was given the opportunity to produce a video, and that video got over 500,000 views on their Instagram page, which was amazing and one of the best performing videos that they had ever had by an external creator, which was quite an achievement. But it also goes to show that if you're a good writer, then you can really perform in any context, whether that's video or a website. I also delivered a workshop for the WHO creators where I went through the do's and don'ts of creating content, and it kind of overlaps with writing as well as video, so what you can show on screen as well as what you can and can't say. So another thing that I did was working with the NHS on their video content, so for their YouTube channel but also on their Instagram channel. And then recently I was filmed by them to produce a video for their hay fever page. So this is a pretty big deal because the NHS hay fever page gets about one visitor every 6 seconds in hay fever season. And that is a lot of people viewing that page. And so it was, again, a privilege and wonderful for them to request and invite me to do this. And so you can see the date that it was uploaded was the 26th of June, 2025, so just a few months ago. And I filmed it with them actually in May. So that's a pretty quick turnaround. So some of the work that I did with the NHS was actually featured in an NHS X YouTube health case study. So they actually learnt, what are the kind of words and structures of videos that you need to use, but also the visuals as well. So it was pretty awesome to be featured in that. And similarly, I've gone on to do voiceovers for the NHS as well. So I think that when you're a writer, you develop a kind of rhythm to speaking. And I think that's probably one of the skills that people don't tell you to develop, but you kind of do it passively, because whenever you write, one of the kind of pieces of feedback that I give people is you should always try to read your writing out loud to see what it sounds like, because if it's awkward to say, it's probably going to be awkward to read. You should probably change that. So I'm pretty good at reading now, and doing voiceovers. So it was, again, a privilege to be asked to do some voiceovers for some of their seasonal videos. So their main long videos and then also some short videos as well, which were clipped. And I also had the opportunity to work with NHS Sussex to go and co-produce some writing easy read guides for women who are from diverse backgrounds and were not sure about their pregnancy journey. So one of the needs for this pieces of writing was to actually produce 5 key topics that would then help them with their pregnancy journey, because they found that women were not having a good experience, and some women were unfortunately getting very ill or suffering as a result. So this was a very important project to work on. And so I went to actually meet women in Brighton and parts of Sussex to actually ask them what their needs were. And then we created the series of 5 topics. So easy read guides, which means that they're really easy to understand, but then also they have simple pictures that people can understand even without reading. And we produced it in English plus 10 other languages. So on the left-hand side, you've got 55 video thumbnails, because I had to create videos 5 times, but then 50 more times for the other 10 languages. So that was a very interesting project for me, and it made me understand how important it is to be inclusive when you're giving health information. So another thing that I worked on was the UK Health Security Agency. I was actually the first creator that they worked with externally, and I produced a video about antimicrobial resistance again. So I seem to have a history, especially as a pharmacist, or a portfolio of work now where I'm really advocating to try and save our antibiotics and other antimicrobials like antivirals and antifungals, which are often overused or misused. And so again, it was a privilege to do that with them. And I'm also part of the LinkedIn creator community. So I am in a private unlisted group, and I do attend monthly community calls with the community managers of LinkedIn. So when people ask me, questions about LinkedIn, I usually have insider information. So I do share that information in my courses or what I'm allowed to share. And so I'm actively involved in learning about how LinkedIn works and what things they want us to create on the platform, which helps to strengthen the communities that I'm building. And then, of course, I've been to all of the YouTube health events over the past few years. And I think YouTube is a great platform to reach people because, again, it's available in multiple languages. And I've also had the opportunity to guest lecture at the University of Bristol. So I taught some medical students about YouTube thumbnails, discoverability, and video editing, and the importance of script writing as well. I'm also currently working with the Fleming Initiative to co-design social media video interventions informed by public behaviors. So we've just had our, I think it was 4 weeks of sessions to try and help people learn more about the threats of antimicrobial resistance. And this is a project that's been running for about 2 years now. And so, yeah, hopefully the result of that will come out next year. And I've also worked with L'Oreal. So they approached me through LinkedIn and I've produced some videos for them. And I'm also editing some articles for them. So I'm using a variety of set of skills that I have. And it's always amazing to kind of see where medical writing could take you. And in general, I have Write Clinic where I produce videos like the one you're watching now and webinars to help people get into medical writing. And the real reason I do everything is because I'm just one person. I can only produce so much content. But if I can teach other people how to produce good quality content, then that means I can have a wider impact. So I've been trying to build this platform through Write Clinic, through the YouTube videos and courses, and then also the Medical Writing Uncut video podcast so that people can learn more about medical writing in different countries around the world. And we've got over 65 episodes. We've got 2 issues of Medical Writer magazine where we have at least 10 articles from medical writers around the world. And that's a digital magazine. And I've also recently launched the International Medical Writers Association, which is something a little bit different. And you will see what happens with that over the coming year. So I've also got a LinkedIn group, which I started in 2021, and that now has over 18,300 members. And it's a massive kind of networking opportunity. And I think it's the biggest independently run medical writing group on LinkedIn. And I just wanted to show you a little bit of a timeline of progress. So this is my LinkedIn back in 2023. And I did not have the experiences that I have just described to you right now with like YouTube Health and the NHS and the UKHSA and the WHO. And a lot can happen in 2 years if you're just persistent. And so this is my profile now, and I've got the World Health Organization logo on there and the NHS and YouTube Health logo and LinkedIn as well. And I've also got Write Clinic, Medical Writer Magazine, and the International Medical Writers Association. And my, again, main reason for doing everything that I do is because I want more of the public and patient to be able to access health information which is helpful and easy to understand and evidence-based. So that's the medical writing Write Clinic page on LinkedIn, which has about 9,000 followers now. There are 2,000 followers on the Medical Writer magazine page, and it's only been out for less than a year. And a massive, massive shout out and thank you to Nicole, who has been helping me as my co-editor and co-designer on Medical Writer magazine. So if you haven't checked her out, then go and check out her LinkedIn. And this is a kind of little preview of what Medical Writer magazine actually looks like. So you can just flick through it online. And you can also watch videos and you can jump to different articles and you can fill out forms on there as well. So the International Medical Writers Association is something that I set up to help medical writers from all over the world kind of form a community where we work on projects together. So anything that you do in the community is for the wider medical writing community, even if they are not part of the association. So you could think of it as a collection of people who want to learn about medical writing from each other, but also share what they know with people in the medical writing community, within or outside of the association. So lots of exciting things coming up with that. And since April 2022, I have had over 3,800 people sign up to learn about medical writing through the Udemy platform. They've written over 1,200 reviews for me, and I think my average star rating is like 4 stars out of 5 or something. And on the Thinkific Write Clinic platform, I've had over 5,400 students sign up as well. And so this is absolutely incredible because it means that I've taught about, I think if you do the math, about 9,000 people, which is amazing. And, even if 9,000 people just created one piece of content, then that could have kind of like a domino effect of content that can help people in the world with their health. And so, thank you so much for patiently sitting through the introduction. Let's get on to the 6 steps to get into medical writing in 2026. So step 1 would be defining what your values are. So I know that some people will have probably watched the 5 steps to get into medical writing in 2025. So I didn't want this 6 steps to be exactly the same. So you can think of these 6 steps in addition to those 5 steps. And you can watch that probably later. I'll leave the link under the video description when I upload it. So the very first step is, what are your values? Now, it's so important to go through this first step before you start thinking about medical writing and what you want to do, because you need to think about what kind of lifestyle you want and how much you need to earn. What are your strengths and maybe your transferable skills, and also ethical practices, as well as your long-term vision. So why do you do what you do? So I would say that your first couple of years are probably figuring out what you want to do. And then as you progress as a medical writer, you need to be a bit more thoughtful and mindful of who you want to work with, because you will start to leave a little bit of a breadcrumb trail. So this means people can see your history of what you have done and who you have worked with. And you want to make sure that when you look back, you're proud of what you did, and also that what you did is a strong foundation for what you're going to do. So if I answer these questions for myself, the kind of lifestyle that I want, which I've been quite intentional about, is I want to be able to have time freedom. So I don't actually want to work that much, but I do want to be able to work enough so that I can do things like travel or go and spend time with my friends and family, maybe go somewhere nice to eat or go to the cinema or something like that. And then how much do I need to earn? So realistically, I probably need to earn about £2,000 to £4,000 per month. And I tend to do that every month. And once you start getting into the thousands beyond that, you will find that you're going to get more tired, and your clients might be harder to find, but also they're harder to keep. So I have had clients who have paid me thousands of pounds per month, but they often will end the contract early, or they don't publish any of the work that I've created for them because the approval process is so long and complex that the content is out of date by the time they want to publish it. So it doesn't go anywhere. And then I can't actually use that work in my portfolio, which is quite frustrating. And I didn't think that that was even a possibility as a medical writer, but it's happened to me and it might happen to you. So just be aware that if you do chase clients that you're going to charge a lot of money, then they're going to have a lot of demands, but then also there's no guarantee that your work is even going to be published. So just keep that in mind. My strengths are definitely being a pharmacist and also enjoying talking to people. So as a community pharmacist, every day I would have to explain things to people. So these would have to be explained in simple terms. And so I was kind of naturally doing what I needed to do as a medical writer, but in a non-structured way. So while it's easy to explain something to someone in person while you're having a conversation, when you write it, it's very different. So the way you put something down on paper is very different to a conversation. And so those are skills that I had to learn as a medical writer. And some of my first pieces of writing were kind of just blocks of text with no headings and very difficult to read. And so I would say you definitely need to learn skills. I'll go through a bit more of what you need to learn in a bit. And my other strength was that I knew all about medicines. So it made sense for me to write product pages or write about health conditions that people would commonly come into the pharmacy to learn about from me. And so that's why it was quite easy for me to get a lot of work writing for online doctors or online hospitals or clinics. And so if you are someone who has that strength in a different topic, so say, for example, you're a dentist and you know all about teeth and different complications and maybe aftercare or maybe preparation before, I don't know, having a root canal or something. So my sister is a dentist. So if I wanted to, I could also say that one of my strengths is I personally know a dentist. So maybe I could have some dental topics that I write about. And that would be an advantage for me because it means I can offer my pharmacist skills, but also probably ask my sister to review some things for me. So it's also about who you know as well. And I would say, think about your ethical practices. So sometimes a client might ask you to do something and it's not right to do that. So one example I can give is when a company approached me and they said, oh, we want you to write about, I think it was some kind of protein. And I was like, okay, can you send me the research papers? And they're like, well, yeah, we don't really have research papers, but here are the different medicines that contain these proteins. And what they were doing was reconstituting medicines. So this is a practice in the US where you have a compounding pharmacy. And especially recently with the injections that have become very expensive, that help people to lose weight, people have been trying to get them in a cheaper way. And so this company wanted me to write about, I think it was peptides or proteins that you can inject. But actually, it was the compounded medicine, which is actually a licensed drug. And I spoke to a medical writer who is also a pharmacist in the US. And they said, no, I don't think you should take this job because they're doing something that they shouldn't be. So they're trying to market a product which is unlicensed, essentially. And so it's so important for you to actually find out about things before you agree to them as well, especially if you're not sure. And I wouldn't want to write about something and then put people at risk and say, hey, you're using this thing, which is actually a licensed medicine, but you're using an unlicensed version of it. And it's basically a cheaper way for you to get the medicine, but the side effects are unknown. So just be aware of what you write being used in a way that's not going to harm people. So my long-term vision and why I do what I do is because I want people to have better access to health information. And as much as I am just one person, I can reach people in high places. So through the WHO and the NHS and YouTube and the UKHSA, it's quite actually incredible. And I'm very, very privileged that I've been able to connect with these people. And it has been mainly through networking. And it means that I can now build a platform which gives other people that opportunity to reach those people. And so if I learn their standards, then I can teach them to other people. And then those people, like you who are watching right now, can actually produce materials that meet those standards and then have that impact to help people with their health all over the world. So that's the main reason why I do what I do. I want people to learn about medical writing so that they can help people with their health. So step 2, finding your perfect match. So this is when you have to decide what type of medical writing you want to do. So I do get quite a few messages from people which say, hey, I want you to help me with medical writing, but they haven't told me what type of medical writing they want to do, what their kind of strengths and skill set is. And so I can't really answer that question without really having a conversation with you. And so if you think about what type of medical writing you want to do based on the type of things that you like to read and write about, then here's kind of a quick summary to help you make that decision. So if you're more of a creative person, which is what I'm like, then I would say try to go more into marketing. So this is when you are trying to sell something or persuade someone to do something. And so this includes copywriting. So copywriting is persuasive writing. That's what I do. That's why I call myself a medical copywriter. And also storytelling. So are you able to tell stories in a way that makes people care and also learn something and then go away and do something? So it's also important to keep in mind that marketing is not just about selling physical products. It might also be about convincing someone. So this could be either, convincing them to brush their teeth twice a day, or maybe make a donation, or maybe book an appointment, or go and attend their screening scan for breast cancer, for example. So it's so important to know that these are ways that humans communicate, but also that they can be used for good. So you're not an evil person if you're selling something. You are trying to help people in a specific direction. There's also journalism as well. So again, if you like telling stories or interviewing people and then structuring what you have learned from them in a way that is helpful for people who are going to read that article. And so that was really interesting for me when I wrote a piece for Pharmacy Magazine, and I had to interview some people who were experts in asthma. And I wrote a piece about how to manage asthma patients that often end up not using their inhalers properly, but then also having an event where it's an emergency and they need to go to hospital. So how can we avoid that? And so the main piece was about how we can manage people on their medicines and how to avoid these emergency situations. You can also design posters and also do social media work. So I do lots of script writing and video creation. And I would not be able to do what I do if I didn't have the skills that I have and be able to communicate in the way that I do. And that has come through practice, learning, asking questions, and working on different projects with different people. If you're more of a technical person and you enjoy statistics and analyzing things and evaluating them, then I would say regulatory medical writing and clinical trials and medical communications, or medcoms, is probably the direction that you want to go in. And you're often going to be working with teams where they want you to have lots of citations and references. And also you're going to be working probably more likely with pharmaceutical companies or companies who have a medicine that they want to market. And so sometimes you could be working with a hospital if you're a creative person, or a magazine or something like that. But if you're more kind of technical statistics, it's more high stakes. So you need much more evidence before you actually publish something, and you're going to have a longer review process as well. So sometimes a project could be 1 or 2 years, whereas in the kind of creative scene, you're probably working on a campaign that's going to run for a few weeks or maybe a few months. So you want to get that out quite quickly. And then if you enjoy educating people, you enjoy teaching, then you might want to consider creating resources for continuing professional development, which is what we call it in the UK, or CPD. I think in the US, they call it continuing medical education, or CME. And you also might want to consider writing textbooks. And this could be either for young people, or maybe undergraduates who are at university, or maybe even postgraduates. So education happens at lots of different stages in our lives. So there's lots of opportunity there for you, and also academic journals as well. So if you really like structuring things like systematic reviews, or maybe literature reviews, and I've seen some medical writers who charge quite a lot for that, but I would imagine it's because they need to do quite a lot of research, a lot of reading, and then they also need to form kind of a logical and evaluative process to then presenting all the information that they found. So it's important for you to understand that if you're going to go more towards the academic route, you might need to apply for funding or be more demanding, because your information is probably going to be used as the basis for other things. So that could be the technical writing or even the creative writing as well. So step 3 is to learn the skills you need. So now that you've got your foundation of values, and then you've also figured out which type of medical writing you like, what skills do you need to actually get into medical writing? So this is step 3 on our step 6 process. So when you are getting into medical writing, everybody needs these things. So you need to be fluent in the language that you want to write in. So some people want to write in English, but maybe they don't speak it very well. And that's totally fine. As long as your writing is clear, comprehensive, and also accurate, evidence-based, etc., then that should be fine. You do not need to be a perfect speaker. If you want to write in other languages, then that is a huge bonus, because on social media right now, they're doing lots of things to try and help people's content to be available internationally. So my content, for example, on YouTube is now available in 18 languages. So that's through the subtitles, but also through the dubbing. And so if the subtitles for my videos are not accurate, then the dub is not going to work. So dubbing is when someone speaks over what you're saying, so it sounds like the language, so they can listen to it rather than read it. And I would say it's a really, really important skill for you to know another language if that's the route that you want to go down, where you can produce things in multiple languages and for multiple cultures as well. Because just because you know a language doesn't mean that you know how to use that language in that culture and that context. So it's really important to think about that as well. And I think that's one of the issues with using AI to translate everything, because maybe it will translate something in a way that's not culturally acceptable. It's also a really important skill to communicate clearly via email, text, social media messages, comments on documents, on the phone, and in meetings. So it's so important to have this skill, because what tends to happen is you'll have a meeting with someone, nobody will take notes, and then everyone will go away and do something different. So if you can get really good at being the note taker and then confirming with people, okay, we spoke about this, these are the next steps. And then you actually go away and do that. And maybe that can make your brief a lot clearer. So a brief is when you have kind of like an outline of what you need to create, what you need to write. Then that is probably the most valuable skill. So being a good communicator means that you're probably going to be a really good writer as well. And so I would also say that the software you need to know as a very, very minimum, and I know some people actually are not familiar with this software, which is why I'm putting it here, is Microsoft Word, Microsoft PowerPoint, Google Docs, and Google Slides. So one of the interesting things I've had to do is I would have a Google Drive where I would drop in Microsoft Word documents, but I wasn't allowed to open the Microsoft Word document through the Google Drive, because then it would convert it into a Google Doc, which would mess up the formatting. So we would upload as a Microsoft Word document, and then I would also download Microsoft Word documents. So we kind of used it almost as a Dropbox. And so it's important for you to know those kinds of technical things as well, because if you do something and it doesn't meet the expectation of the client, then that might be a difficult conversation to have. So if you're not familiar with Microsoft Word and Microsoft PowerPoint or Google Docs and Google Slides as a minimum, then go and play around with them, watch some tutorials, and make sure that you are familiar with them. The other kind of universal skills that you need to know as a medical writer are regulations. So no matter what type of medical writing you are doing, it will be regulated in some way and in the country or region that you are producing it for. So, for example, in the UK, I cannot be seen to advertise prescription only medicines because it's illegal. But in the US, you can. However, just because you can in the US doesn't mean that you can just start talking and selling prescription only medicines. There are still regulations about how you can sell it. So sometimes it's not as clear cut as some people may make it out to seem. So make sure that you understand the regulations. And this goes for, again, every type of document you can think of, whether that's a social media post or it's a regulatory document that's going to help a medicine get approved and go to market and help people with their health. or if it's a piece of journalism. So think about what you are publishing. Were there any kind of non-disclosure agreements that were signed? Is that person that you've quoted, have you checked the quote that you are going to publish about them? Because that's going to be permanently attached to their name and reputation. And so it's important to go through that with that person before you publish. You also want to understand what a brief is and how to question it. So if you're unfamiliar with what a brief is, I just mentioned a moment ago that it's an outline of what you need to include in the piece of writing. And so sometimes your brief may be, these are the headings we want you to include, or the brief could be, we want you to create headings. So there's a big difference between those two, because then you're going to have to research what are the best possible headings that you need to create. And then you're probably going to have to get your client to review them before you actually write the piece. Whereas if you already have the headings for your blog or post, then it's much easier to just write under them. So if you're unsure about anything on the brief, then you must ask at the very beginning. So the sooner you review the work brief before you do it, the better, because it means that you're also really attentive as well. And you're not kind of leaving things last minute. I'd also recommend that you learn how to write for a variety of audiences. So this includes kind of healthcare professionals or patients, but also possibly a sales team or maybe a group of researchers that are going to be attending your kind of talk. And maybe you're writing a speech for a conference, or maybe you are producing a slide deck. So it's important to understand what people will be looking for when they are reading your writing. And when it comes to patients and public information, which is what I specialize in, it's so important that you do not miss out the technical words, because they're going to go and see a healthcare professional, and the healthcare professional is going to use technical words. And then they need to have some kind of familiarity with that technical word. Otherwise, they're not going to be able to get the most out of their care from their healthcare professional that has seen them. And for healthcare professionals, you can be more technical, but also try and think about what's new information, or what's the expected information that they should know. So sometimes with healthcare professional information, let's say you're writing for a pharmacist, some training material in the pharmacy, you might want to have a little, a quick recap of how something works before you introduce something new. And that can be really helpful for them, because it's a quick reminder and they don't need to go and look it up to then understand the new information that you're giving them. You also need to know how to find credible sources of information. So if you're ever not sure about where to find credible sources of information, ask your client. Or you can go and look at the sources of information that you are looking at right now and see who produced it. So usually if it's some kind of university, if it's a large sample size for research paper, for example, or if it's a meta-analysis that's kind of been statistically created, because I did a meta-analysis for my master's degree as a pharmacist, and that would be kind of the most robust, credible source of information, but might not serve the purpose that you are writing. So sometimes there are things like real world evidence that you might need to include. And I would also say that sometimes you just don't have much evidence, and you need to be honest about that. So if you are trying to say, I don't know, vitamin C uh, helps to improve your lifespan, there's probably not going to be much evidence around that, but you need to be honest about that and say, we think that the evidence might suggest this, but more research is needed. So it's so important to include that context. You also need to know how to reference and cite things. So interestingly, my husband actually works in diversity, equity, and inclusion, and he's working on some AI practices in education at the moment because he's a teacher. And somebody suggested a way that you could actually include a citation from AI. So that might be coming soon and something you might want to look into. But generally, there are different ways that you can reference and cite things, and there are different styles. So you might have heard of the AMA style or the Vancouver style or Harvard style. And if you've done a Bachelor of Science degree, then you're probably familiar with how things are referenced and cited anyway. So just be familiar with different styles and ask your client what style they would prefer. I'd also recommend that you learn about search engine optimization, because if you're going to be publishing anything online, then that's quite a relevant skill so that people can actually find it using the keywords that you include in your writing. So keywords can be either a single word or a collection of words. So that could be a phrase. And I would recommend that you definitely learn that skill. Just go drink some water. So, specific skills for creative medical writers would be things like persuasive writing. So, understand how to do that. And there are plenty of fantastic books I could recommend. One of them is definitely like 50 Tools for Writers by Roy Clark. And I would say that's a really helpful book. And there are also things like How to Write Clearly by Tom Albrighton. So check those out. Then there's also storytelling and interviewing people. So how do you write an engaging story? And how do you also interview people so that you get the information that you need if you're going to be telling their story? You might want to think about different ways that you can think of original ideas. So as they say, most ideas have already been done, but maybe you're thinking about fusing two different ideas to create something new, or taking apart a current idea to make something new. You might also need to follow certain trends or interests of the public. So recently I did a video on how paracetamol does not cause autism for the NHS, and we did that as a collaboration, and that was published on Instagram. I also published it on LinkedIn and on YouTube as well. And it's important to have some kind of responsive content as well. So by responsive content, I mean producing it in the moment, so something that's quite quick turnaround. You also want to be able to structure writing for their specific purpose. So that this could be for a website page or a leaflet or a poster or different social media platforms. So what you post on LinkedIn might not necessarily be suitable for X or Twitter or Blue Sky or somewhere else. So think about what works in their specific contexts. And you might also want to have an understanding of design as well. So I have worked with quite a few designers as a medical copywriter, and usually you might need to either cut something down so that it fits into the design, or you might need to lengthen something so that you can actually fill that space. So specific skills if you're more of a technical writer. So I would say SEO is probably the least relevant if you're going to be a technical medical writer. So regulatory medical writing or clinical trials or medcoms, unless you are publishing something online that you want people to be able to find through a search engine. So you want to be able to understand statistics, how to analyze data, how to evaluate data, and also how to pick out key points and summarize things. So if you're able to present findings in a concise way, then that's a really, really helpful skill, because often people will get a medical writing test that says, oh, here's a piece of literature, we want you to read it, and then you have one slide to summarize the key point. And that is a really hard thing to do. And it's a skill that you develop over time, but you get better at it as you learn more and more how to pick out important key points of information. You also want to know about regulations for your specific region or documents. Now, with technical writing, there are going to be more regulations compared to things like social media, and also it depends on, again, the country and the audience that you're going to be producing that information for. So if you're the third type of medical writer, which is more educational, then you need to think about the types of educational resources that you're going to produce. So are you going to be creating a course or a short kind of digital presentation or a video or maybe a leaflet or an ebook? So you need to know how all of these things work, and then you need to identify the learning needs of your potential students, and then how to structure the course or the specific learning materials that you're going to be creating. And then you also need to learn how to check students have actually achieved the learning outcomes that you set out from the beginning. So how can you test them before you give them a certificate, for example? And then you want to know how to update learning materials so that they stay relevant. So similar to how I was checking the NHS.uk health information pages, we would always have a date of publication, but then also a review date so that things would not be older than about 2 or 3 years old. And so if new information comes out even the following year, you need to be perceptive to that and then think, oh, okay, well, I wrote about that last year for this learning material for healthcare professionals. Now I need to go and tell my client that actually I need to update that. And then it can be a way of getting repeat business, which is quite helpful as well. So step 4, you need to start writing and also get feedback on your writing. So this is step 4 in our 6-step process. So a lot of the time people ask me, what do you actually write about when you are trying to get into medical writing? And this is a very valid question. And when I asked myself this in the very beginning, I thought, okay, well, I need to write about something that I like. And what I really enjoyed is travel health. So I started writing about Japanese encephalitis and rabies and vaccines that you might need if you go abroad, maybe yellow fever and things like that, because I found tropical diseases very, very interesting. So think about what you enjoy reading about, what you enjoy learning about, and then just pick something. It does not need to be perfect. You don't need to think about it too much. And I also had a student who was doing a PhD and she said, oh, can I write about the topic I did my PhD on? And I said, yeah, absolutely. You're probably the best person to write about that topic because you just did a PhD on it. And so you can pick something out of your PhD and talk about that, but you don't need to talk about the whole PhD because the PhD is a very kind of comprehensive overview and research into something new. And so even if she spoke about maybe a single piece of literature that she came across that was specific to her PhD, then she could summarize it. And I think it's important that you are confident to write about it as well. So if you've reading about it and you're learning about it a lot, then it's going to increase your confidence. Because I've definitely experienced as a medical writer when somebody gives me a topic and I don't know about it, I need to go away and then learn about it before I start writing about it because I'm not going to feel confident that what I submit to the client is actually suitable for use and suitable for publication to whichever audience I'm writing for. So think about what you are confident to write about. And then you may want to also consider reproducing that same piece for different audiences. So one of the writing tests that I had to do, which was actually part of my job interview, was to write the same thing, but for a professional audience, for doctors, and then also for a general audience. And I didn't realize at the time that they took the 2 different versions and then they had 2 other people that they were interviewing and they gave a user group actually all 3 pieces of the writing, so from me and the other 2 candidates, to actually judge our writing. So I only found out after I got the job that I had the best writing of the other candidates. But it also gave me confidence in my ability to write for different audiences as well, because they said there was a distinct difference in the way that I wrote. And the professional version was more technical. The public version was much easier to understand. And I used words which were most people were able to understand, even if they don't know English or they're still learning English. So try to think about different audiences that you can write for. So when you publish your writing, it does not need to be peer reviewed and put into a journal to count as medical writing. So times have changed, they have moved on. Now we have social media, we have websites, and we have lots of different types of publications. So again, we've got magazines, but now they can be digital as well. And so I think it's quite good that you've got that sense of variety that you can do in your career as a medical writer. And you want to ideally publish online so people can read it and they can find it either on your website, your LinkedIn, maybe Substack, and maybe your Medium. Do not put your writing in a Google Doc and send people a link to that Google Doc because it means that you can edit that piece of writing at any time. I mean, yes, you can edit that piece of writing on your website, LinkedIn, Substack, Medium, wherever. But it also means that there was no publication date. So they don't know how old that piece of writing is. And I just think a Google Doc is probably less professional, and there's no opportunity for people to comment on it as well. And so people like to see the kind of interactions that you have with your writing as well. So if you're a regulatory writer or thinking about getting into regulatory medical writing, then you can demonstrate your skills that we discussed in step 3. So you won't be able to actually do regulatory writing until you get into the job, but you can do things like you can analyze a paper, or you can discuss the results of a meta-analysis, or you can pick out the key points from a piece of literature. And as long as you can demonstrate those skills, then that's going to be really helpful to someone who's looking to hire you. And one of the tasks in one of my medical writing courses, which I gave to the PhD student, was that they would take that piece of literature and just give, a little summary of it, and then key points, but then also a little bit of an evaluation. So what do they think could be done better from that piece of research? And it was a really great LinkedIn post that got her a lot of attention. And I think sometimes you just need to present your skills in that way. So it's also super important to get feedback. And so you cannot tell if your writing is good enough on your own. And so some of my first pieces of writing were quite embarrassing, to be honest. And I would show them to my little sister, who was really interested in writing. She was much younger than me back then. And she would say, oh, that bit sounds confusing, or I don't understand this bit. And feedback in the beginning is actually really hard because you're more likely to take it personally. And it's because you're trying to develop your skills and you're trying to get good quickly so that you can feel confident and feel like, okay, yes, this is the job for me. And you want people who are going to kindly comment or review your work, so in a constructive way. So I have had people who write comments on my work and I just don't understand the feedback, or they can be quite cutting and they can say, well, this doesn't make sense. But what don't you understand about it? So there's a way to receive feedback, and you can also question it. But then if you find that someone's just not being helpful, then I would avoid asking them for feedback again in future. So when I try to review people's work, I always try to be as constructive, as kind as possible. And then also you want to know what you're doing is good so that you can keep doing that good stuff as well. So when I was giving feedback to the writers I was working with for like the online project, and also the London Clinic website, we had hundreds of pages. And so these are writers that are going to go away with a stack of pages. They're going to write all of them and then come back, and I'm going to give them feedback. And I don't want to be giving them the same feedback over and over again. So I have to make sure that I tell them what I really love so that they keep doing that. Then also what they need to change that they can go away and change in all of the articles and also going forward. So make sure that you carry that feedback forward as well. So the person who's giving you feedback doesn't have to repeat themselves. Another thing you could do is pay for an expert to review it. So that is an offer. That is a service that I offer. And there are many medical writers on LinkedIn that you can find who can also review your writing as well. And so I would say find someone that you like and then ask them to review your work, and make sure that they can actually review the work before you give it to them. So, for example, I wouldn't be able to review your very technical piece of writing, which has a lot of analysis and statistics in it, because that's not the type of writing that I do. But I would be able to review something if you have written it for like a patient or public audience, or maybe even for a healthcare professional audience, because I am one. And so I could actually determine if it's helpful for me. And I would say that it's so important that you find someone that actually does the type of medical writing that you want to get into and get them to review it, even if it's just once or twice, because it'll give you a real insight into your level of progress as well. So you will learn faster, improve your writing, and have a portfolio that you can be proud of to hopefully help you get some work. So step 5 is selling your skills. So this is step 5 in our 6-step process. And so beginner sales skills look like this. So you're applying for a job and hoping that your CV or resume sells your skills. And maybe you just drop off your CV on a website and send it to a recruiter and then tell them what job you want. And then also maybe you send people you don't know a random message via LinkedIn or an email, just kind of asking for work. So what I would recommend you do instead, so this is kind of like a pro sales skills level, is that you have a proper portfolio or website with 2 or 3 pieces of writing that you are proud of to demonstrate your skills. Because I could say, I'm really good at writing for patients and the public, or I could say, I wrote the script for this video, which got 500,000 views. So who would you hire? Someone who said it or someone who showed that they can do it and they have the results to prove it? You also want to have an established LinkedIn profile where you post about once a week about something that you've learned or a person you met or an opinion that you have or maybe an event that you attended and maybe a few things that you learned from that event or maybe some awesome people that you met. And this also shows that you have some kind of social networking skills. So it's important that you get on with people if you're going to be a medical writer because you're going to be working with people to produce pieces of writing that are going to help people with their health. So it's quite important that you are showing that you're actively writing and people are also actively engaging with what you write as well. So this doesn't mean that you need to get 100 likes on your post. It just means that it needs to exist. So people can go and see your portfolio of work and the kind of things that you post publicly. And people also love it when you work for a company and you're able to also express yourself on your social media profile about how you work for them or what you enjoy doing them, because that's kind of like free marketing for them as well. So there's a bit of give and take with your social media profile. And I've definitely been in this situation where I work for a company and they want me to post on my personal page. And I've never really been pro doing that, but only if it kind of demonstrates my skills or my learning and it benefits me as well as the company, then I'm happy to do it. You also want to warm up to people before you ask for anything. So if you get to know someone maybe for a few months, then they get to know you as well. Then you build up some trust. And I've also had people who don't respond to a message for about 1 or 2 years because they want to observe who I am before they actually respond to the message. So I literally got a message yesterday from someone I messaged in, I think it was December last year, where I said, hey, I really like your work. I'm going to put a link to it in Medical Writer magazine. I hope that's okay. And it was like a public blog that they had written. And they got back to me and they were like, I'm so sorry I missed your message. Thank you so much. And I just really, really apologize. And I was like, okay, thank you. And this is, 2 editions of Medical Writer magazine later. So then I asked them, oh, do you want to be on my podcast? Because I really love your work. And they were like, yeah. So some people just want to get to know you before they actually respond to a message. So don't take it personally if they don't reply straight away. But then also if you really want to get in touch with them, then I would say maximum follow up every couple of weeks. Because if you follow up every day, that can get a little bit annoying and maybe they're on holiday or they're ill or they're working on something. So I like to follow up every couple of weeks. And I think I had a meeting with someone in August and then I followed up 3 times since then. So it's been about 6 weeks and they finally responded. So turns out they were really busy. And they actually asked me, how much do you charge for your work? We're really interested in working for you and so on. So be respectful of other people's time as well. So networking, everybody says this word, but nobody really does it properly. So here's what it means. So you want to attend events online and in person. So there are events in person that happen in the UK. I literally fly over for. So I will pay £200 for a flight ticket and spend 3 or 4 nights in the UK just to attend like one event. And that's how important networking is to me. And that's how I've got the opportunities that I've got, is because I'm going above and beyond to attend things that people might say, oh, I can't make that day because I don't know, I'm finishing work late that day or something like that. But I really make the effort to go to these events because the people that are going to be there are really difficult to contact online. So if I can meet them in person, it's kind of like a golden opportunity. And so I think of that £200 flight ticket as an investment. So I would say you don't need to spend that much to network online. Sometimes, again, like I said, you can just be persistent. So every couple of weeks, say, hey, I'd really love to have a coffee chat to find out more about you. Um, and so sometimes people will get back to you. And so I would say be persistent or try to invest a little bit in attending an event. Now, you don't need to go to an event every month. You can go once or twice a year. And so my budget is usually about 3 or 4 events per year. And you'll usually see them happen throughout the year because I'll post about them on LinkedIn. Because again, it's an investment for me. So of course I'm going to post about it and share what I learned and my experience. And it shows people again that I'm invested in my learning and meeting people. And try to reach out for people for a chat rather than for work. Because again, it's hard to work with someone that you've literally just sent one message to. So just think about your motives and again, your long-term goals as well. And share what your goals are with that person as well. Say, hey, I'm reaching out to people because I really want to learn from them about this career that I might want to go into. And I've been really inspired by your work. Do you have 5 minutes on, I don't know, Wednesday next week or something? Where I can just ask you a few more questions. And most people will say yes to that. So for some people, you might have to pay for their time, and it's because they're super busy, and the value of time increases as you get older. So make sure that you are giving someone something worthwhile to talk to you about, and maybe something that you can share with them in return as well. So another thing that you could do, which most people don't often say, is ask the person that you're speaking to who you should speak to next. So this can help give you what we call a warm introduction. So for example, if somebody was speaking to me and they say, hey, I'm from Canada, is there someone that you can recommend that knows about medical writing in Canada? And I could be like, yeah, I know this lady. You should definitely reach out to her because I'm not an expert in medical writing in Canada, but I have interviewed someone for my podcast who is. So you can check out their podcast to learn more about what they do, and then maybe check out their website, and then maybe you can reach out and say, hey, I learned from Virginia that you're the person to speak to about medical writing in Canada. And I checked out your website or watched your podcast with her. It would be great to have a 5-minute chat. And then they'll be like, oh, this person's really interested in me. Let me talk to them. So I think that's probably one of the best ways to get to someone. And I love it when people tell me, oh, I've watched like 50 of your videos and I just had this one question that I didn't see before. I didn't see you answer before. And that's really intriguing to me because I've got like 500 questions from people just from this webinar. And so I intend on answering all of them in future videos. And I think it's really nice when somebody has shown that much interest in you and they've invested that much time. So it's worth it for me to actually speak to them. And someone actually, thank you, Rick. Someone actually said to me, oh, I watched one of your YouTube videos and the beginning 30 seconds is kind of like, I think you were meant to edit that out. And I went and checked the video and I was like, oh my God, they're right. And I cut it out. And that video had like 400 views. And I was super grateful to that person that I gave them a free 30-minute chat. So talk about anything that they wanted about medical writing. And they were super grateful, but I was even more super grateful because they actually took the time to say, oh, maybe there's this thing that you want to change. And I most of the time will reply to every single message that I get. So thank you so much, Rick, for saying thank you for your efforts and attention to us. So yeah, I give you attention back if you give me attention too. So I really appreciate it. Thank you. So the other thing you could do, of course, is join groups and get involved in conversations in the comment section or in a chat or a forum. So sometimes there are WhatsApp groups as well. And so I would say if you're in a group, hooray, you're in a group, but then go and have a look at the type of posts that are out there. And what you'll find is some people will post, but they'll never get any comments on their posts. And So I'm usually the first person to comment on every single post. And I think that, thank you for saying that my videos are helpful. Thank you for watching. I really appreciate it. So it encourages me to make more. Like we are right now, we're making a video in real time. So I would say be that person that actually gives their thoughts and opinions. So even if you need help on that topic as well, just say, hey, that's a really great question. I want to follow along on this topic. So let me know what you find out. And maybe you could find out for them and tell them, oh, hey, I found this out. And just being helpful is a great way to network and being interested in other people as well. So another thing I would say in terms of like selling your skills is interviews. So practice your answers with a real person or with AI. So there are a lot of kind of like AI generators where they can ask you questions and then actually rate your response so that you get some real-time feedback. Now, better than this would actually be to speak to a person who prepares people for interviews, and they will have lots of experience of interviews, and then they'll be able to give you that feedback directly. But obviously, there may be a cost behind that, so it depends on your budget. Another thing you could do is to film yourself and then watch and listen to yourself back. So then you can see the kind of things that you do which might make you look nervous. So for me, in the very beginning, I used to touch my hair a lot because my hair is really long and it gives me a lot of pleasure to stroke my hair, which sounds really strange. But I cut my hair really, really short when I was younger. And so I was like, I'm never going to cut it this short ever again. And so I've grown it ever since. And now it's super long and I might need to trim it. But it gives me a lot of comfort and it's also really fun to play with. And so I would say that that's probably not a good thing for me to be doing in front of someone in an interview situation. So I usually like tie my hair up or I just tie it to one side and I avoid touching it. So that's something that I picked up from watching myself. And then also listening to yourself as well. So if you find that you're tending to pause a lot before you speak or you sound really nervous, then I think that's something that you just need to practice and get confident speaking out loud. So often we don't spend a lot of time speaking about ourselves. So when you finally have the opportunity or you need to do it, it feels very strange because you know everything that you've done, but you now need to package that information in a way to make yourself look good. And we're not very good at selling ourselves, especially if if you change job every few years, then you haven't had to sell yourself for years because you've been spending the past few years building experience in a different job. So you now need to have a new pitch to include your new experience. And so it's kind of like when you update your CV, but you have to do it in person and you have to talk instead of write it down. So try to practice your pitch for yourself, especially useful for interviews. And then also, if you take calls from a recruiter, so sometimes on LinkedIn, a recruiter might reach out and say, hey, we might have some opportunities. I like your profile, which used to happen to me a lot in the beginning, which was quite nice. I think LinkedIn was less popular back then. So they were kind of just reaching out to everyone. Whereas now you'll see recruiters post and they'll just put their email and you need to email them. And some recruiters actually put their phone number in their post. So you could actually send them an email and say, hey, I'm going to call you on this date at this time. Does this work for you? Or you could just give them a missed call and a voice note or send them a text or something to say, hey, I'd really love to have a chat. And then you can practice your pitch. So how would you sell yourself to a person who potentially wants to find you work? And so a recruiter wants to find you work because they are actually going to get a cut of your salary. Not that you would see that salary missing, it's that they charge a premium for finding you and placing you in a job. It's usually something like 10% or more. And I would also say that it's interesting to speak to a recruiter because you can find out things from them. So what are people looking for in a medical writer in this current market? And so when I was taking calls from recruiters, I would strategically ask them questions like, what's the market like for medical writers who write for social media? And they'll say, oh, actually, the market's quite good. A lot of people are looking for that right now. And I'm like, yay, I'm going to keep developing this skill. And I would say, okay, well, I have this skill and I'm really interested. So let me know if anything comes up. And they'll be like, yeah, okay, we know lots of people are looking for this. So we're going to reach out. So speaking to recruiters is a great way to find out about the market in particular, because they're constantly trying to match people up with jobs in the market. So another thing is always position your skills as your strengths. So one of the things that I did for my very first job in a medical communications agency as a medical writer and project manager is I would say, I'm a pharmacist, so I can medically and accurately review all the writing, and I know how to use a BNF, which is the British National Formulary, which has all of the drugs that we use in the UK. And so, that really set me apart from the other medical writers, because again, it was very specific that they needed someone for as the online doctor, and it was clearly going to be some kind of doctor/pharmacy prescription service. So actually having a pharmacist who's also a medical writer is a very helpful thing. And I also at that point had a portfolio of pages that I had reviewed for another company, Online Doctor. And so that really helped set me up for strong positioning to get the job in the medical communications agency. But once that project ended, well, there were a few projects. Once those projects ended, then unfortunately I was made redundant because there was a bit of a recession due to the time of health that the world was going through at the moment at that time. So the final step 6, we finally made it, is to diversify your skill set, which is something that I said in the very beginning. And this is the full 6-step process. So you have defined what your values are. You've found your perfect match for the type of medical writing that you want. You've also learned the skills that you need. You're going to start writing and getting feedback on your work. You also know now how to sell your skills. And then now you know how to do all these things. How do you diversify your skill set? So as much as learning about writing being the foundation of your skill set, you may also want to learn the following, which are all things that I have done. So learning how to use different types of AI. So whether that is something that is going to be editing your work or reviewing that it meets standards, or just checking for little things like spelling mistakes, or SEO as well. So I have used lots of AI tools for SEO, which is search engine optimization, where you've got the keywords that you need to include in your writing. And then you should also learn how to edit as well. So you can't write and edit at the same time, because when you edit something, you need to look at the whole piece and then look for consistencies or inconsistencies. And then actually, maybe you want to rearrange the writing. Maybe you need a new bit in or to take something out. And it's really important to learn how to edit. I'd also recommend that you learn how to fact check. So that's a lot of what I do now as well. And that means that you are going to find the sources of information yourself and check that the statement that has been written is actually correct. I'd also recommend learning about repurposing. So that's when you take a piece of information or a piece of content and you recreate it for something else. So this could be taking a video and then picking out quotes so that you can use it in an article. Maybe you are writing for a magazine, or maybe you are taking a piece of literature and then you are digesting it for a healthcare professional audience where you need them to learn the new research that has come out. And also strategy. Strategy is when you decide how you're going to produce something, when you are going to put it out, and how you're going to distribute it as well. So you also look at maybe your competitors, and you maybe also look at the journey that the person is going to go through when they are experiencing your content. So maybe, for example, with Medical Writer Magazine, we produce the magazine itself. And then I have to think about, okay, how am I going to actually tell people about Medical Writer Magazine? So I might make a video about it. I might write a blog about it. I'm going to write a LinkedIn post about it. I'm going to also ask if the authors are happy to post about the Medical Writer Magazine and that their publication their articles actually published in the magazine. So I need to think like way beyond just the magazine itself. I need to think about the strategy of distributing it and making sure that people actually give it some attention so that they can really learn from it and hopefully find it useful. So if you want personal guidance to get into medical writing, then you might be interested in the Ultimate Guide to Medical Writing, which is a package of 17 courses that I will guide you through. And this will start with learning medical writing skills that are digital writing skills. So this is kind of geared more towards the creative medical writer, not so much the technical or the education medical writer. So here I will actually go through your portfolio and also your CV and your resume, your LinkedIn profile, and give you some tips on your copywriting, plus your website and your pitch, which is how you sell yourself. You can also ask questions at any time via a WhatsApp text. So I have a dedicated WhatsApp text that you can text me through. And also, if you want to arrange a call, then I'm happy to have a video call with you as well if you prefer that. So what's inside? So this is part 1 of 2 that's inside the Ultimate Guide to Medical Writing. So you've got medical writing skills for beginners, medical copywriting for beginners, and also regulatory medical writing for beginners. I also go through the kind of regulations in the regulatory writing for beginners course. So I'm not teaching you technical analysis skills. But then I also show you SEO, so search engine optimization. So it's kind of a beginner's guide, but it's kind of the foundation of SEO. And I know people are saying, oh, AI is going to get rid of SEO and we don't need SEO, but actually AI is based on traditional SEO. So this course is still relevant and it's pretty much an evergreen course. So I do update the courses as well a few times per year. I also go through how to find clients as a freelance medical writer and also how to create a LinkedIn profile to attract recruiters and clients, because I'm in the LinkedIn creator program and I've been on LinkedIn for more than 5 years and it's how I find all of my work now. And I also spend way too much time on LinkedIn. But it's because I built a community. So thank you so much, Rick. Yes, so courses do get updated quite regularly. Thank you for your question. So I would also say that I go through how to create a medical writing portfolio, because there are different ways that you can do it. There's a quick way, then there's the kind of longer way when you're a bit more established and you've got more things to show off. I also give you a few examples of medical writing tests that I've had to do, and you do an example medical writing test. And I also show you a bit about how to master your work-life balance, because it's really important to me that you do not burn out as a medical writer. And you also appreciate that it's a long-term process to become a medical writer, and also you want it to be a sustainable career. There's also inside how to set up a website to own your online work. And so I would say having a website is pretty helpful, especially if, I don't know, LinkedIn is not working or Instagram is not working. Then people have got somewhere to go that they know that you've created that is specifically about you. So it's your history, it's your kind of massive sales pitch, just all in one place with no distractions. And I also go through how to find employment opportunities if you want to look for a part-time or full-time job rather than freelance. And I help you with medical writing interview skills as well, of course, and how to manage your finances. And then here are a few kind of specific skills that you may want to learn as well. So how to write scripts for health videos. So I've done that for a few years now, and with the WHO and also the NHS and the UKHSA and L'Oreal and YouTube. And I also go through design and Canva skills for medical writers, because a lot of medical writers are really good at writing, but sometimes they just need a little bit of help to have some kind of visual, whether it's just like a simple graphic or animation, to help people get more attention. And I also am working on a storytelling course for medical writers, and a very important course to me, which is how to write health information for patients and the public. So those two are coming soon towards the end of this year / beginning of next year. So those will all be included in the Ultimate Guide to Medical Writing. And you can find that at the link that I will share with you. I'll also put it in the description box under this video when I upload the video. So, thank you so much for being here. I really appreciate your presence. And I've had such a great time going through all of this. And thank you so much for all of the love hearts and claps. That's really sweet. And I hope you enjoy the rest of your Saturday. I wasn't sure if anybody had any other questions. I'm happy to take them now. Thank you. Thank you so much, Charlotte, Sylvia, Babine. There's also Kira and Rick. There's also Elle. Hello, Elle. Okay, I've got a question from Kira. Do you find... I've lost the question. Do you find it's more reliable to work freelance than to try and find a full-time job? That's such a good question. Okay, so the way I'm going to answer this is through my experience. So finding a full-time job is very challenging, in my opinion, especially at the beginning. So if I didn't have my portfolio of work that I had to grind for on Upwork, where I got paid barely anything, and I didn't have my blog, and I didn't do any script writing, then it would have been really hard to convince an agency to pay me like 40 or 45,000 pounds per year as a full-time job. So I would say that finding freelance work is probably a bit easier because you're looking for smaller kind of short-term jobs. But the only issue with that is that you have to find quite a lot of them if you want to make a career out of medical writing. So I had a little bit of a competitive advantage because I'm a pharmacist, and I was able to kind of build my portfolio quite quickly over about 6 to 12 months. And then I was able to then, build my LinkedIn profile. There was a lot less competition, and then a recruiter found me, and that's actually how I ended up getting my first job. So it didn't matter how many jobs I applied for. The critical link for me was actually being referred by a recruiter that actually liked my work and thought that they could match me with this job. So yeah, exactly. Kira says that she's struggling with entry level roles because there are very few of them, and the companies seem to hire experienced writers or those that are, not really entry level. So yeah, I would say that is one of the challenges. And I think it's going to become more challenging because even though there's AI and things like that, I think a lot of people actually want to get into medical writing, again, for the lifestyle career. Okay, this is a question which says, I'm a complete beginner and also look forward to getting into medical writing. My question is, after picking a topic for writing, what do we write about that, and how to get to know that piece of writing or that article is fit to be called medical writing? So if you're writing about a health or medical topic, then that is a piece of medical writing. But to kind of take it to the next level, I would recommend that you actually take my medical writing skills for beginners course, which is free. You can actually access it right now on YouTube. I'll leave a link below. And you can also get a certificate for that. And I would say that if you follow my instructions in that course, then that will actually help you understand what we mean by a piece of medical writing. So it needs to have a clear structure, clear set of headings and hierarchy of information, and also use credible sources of information. And then also make sure that you put the date that you wrote it, so it actually has a publication date, and then also a review date so that people know that you're going to revisit that piece of information. I would also recommend that you make it really clear which audience you're writing for as well. So is that piece of writing meant for a public or general audience, or is it meant for a healthcare professional audience? Because it will affect the way that you write it as well. So make sure that you choose something within that topic that you are confident to write about, and try to make it as specific as possible. So, for example, when I wrote about topics around travel health, I would pick very specific topics. So I would write about rabies, for example, as a single blog. So I would talk about, how do you treat a rabies bite, for example, and then another blog could be what is rabies, and then I could actually link that blog to the other blog. So if I mention in the what is rabies article, how do you treat a rabies bite, go and read this next article, then I would actually link it to the other article that I wrote, which is how to treat a rabies bite. And then you've got a bit of a series. So if you can think about your writing as a series, then I would say that's probably the easiest way to build your portfolio. So somebody asked how many items are needed for a great, convincing portfolio. So I would do as I just suggested, which is to write a series of articles that are probably connected in some way. And I would also say that it's important for you to present your portfolio in a professional way. So don't send people a Google Doc link, actually put it on the internet, either on your website or on LinkedIn as an article. Make sure you include a picture, or maybe if you really want to record a short video, you could also record the audio for your article as well, so people can hear you reading your article out loud, which would be really cool. And I would say, yeah, just try to include other things in your portfolio, like who your target audience is, so who are you writing for, and then why did you write that particular piece of writing. So for example, for me, I would say I've been a travel health pharmacist for the past 5 years. For you, that could be, I studied this topic during my Bachelor of Science degree and found it really interesting. And this is one of the very small kind of niche areas that I found fascinating. And so I wrote an article about this topic. So yeah, great question. Someone said, can an MPharm student start medical writing within their studies? So if you are a student and you're an undergraduate, I would say focus on your studies first. And until you get to kind of your later years of your degree, maybe your final year or the last 2 years of your degree, then you can start consider doing some medical writing, because you need that degree first, because that's what you're investing in. You are paying for that education. So make sure that you get that degree and then you can start thinking about doing some writing. So even if you write maybe one thing per month, by the end of a year, you're going to have 12 pieces of writing in your portfolio, which is amazing. And if you wanted to, maybe you just have 3 pieces of writing, but you have maybe gone to an expert and actually asked them to give you feedback on each of those pieces of writing. So then you've got 3 amazing pieces of writing because you've got feedback and you've actually edited them. And so I would say that's probably one way to approach building your portfolio if you're a student. And if you can find work as a medical writer as a student, which is possible, you're probably only going to do a few hours per week or per month. So I used to work with a student who was in their final year of medical school, and they were really good at writing, but they only did about maybe 5 hours per week, which is one blog article. And then they did nothing for a few months because that was when they had their exam season. So when you're trying to run a business, you need people who are reliable. So I would say that if you're a student, it can be more difficult to convince an agency or a client to take you on because you might have stuff that comes up, which is more important, like your exams. So yeah. So Heaney is asking, do we need to limit ourselves to a single type of writing, or can we vary between technical and creative? Great question. So you can vary between different types of medical writing. You don't need to just write about one type of thing, because you might also want to learn things from the different types of writing. So for example, with educational writing, I learned how to structure a course. And then that helped me as a creative person because I love to teach. Then I was able to create my own courses as well. So I would say it's really helpful, even if you look at technical medical writing, where you're going to learn how to analyze and understand statistics that can really help you be a more persuasive creative writer. So there's a lot of overlap between the different types of medical writing, so you don't really need to box them as separate things in your mind. But I would say that if you specialize in a type of medical writing, you're probably going to be in that type of medical writing for a long time, but it doesn't mean that you have to stay there. You can always switch to something else. It just means there's going to be a bit of a learning curve if you do switch to the different types of medical writing. So thank you for your question, Sahini. And yeah, you're welcome, Irina and Nitin and Sahini. I think there was a question that I missed up there, so I'm just going to scroll up a little bit. Yeah. So Baveen asked, do you have a WhatsApp channel or group where you share some updates on medical writing? So I do have a WhatsApp channel for Write Clinic, but I have no followers because I haven't advertised it yet. So you are very clever. So I'll put that link in my in the video description, so then you can follow the WhatsApp channel. So yes, I do have a WhatsApp channel, and I do have the intention to start updating it with information on medical writing. So I will share that. Thank you. I'm just scrolling to check if there are any other questions. Okay, cool. Awesome. So, share with you the channel. Okay, I will. I will email it to you, and I'll also put it in the video description box. So I'm literally going to upload this right now onto YouTube, but I will email you the link. So, because I need to get it from my phone onto my computer, so I need to email it to myself. So yeah, I think the first post in the channel is going to be to watch the replay of this webinar. So yeah, I'll send the link for the course as well. I can give you the link for the course now, actually, because I have that open. So this is the course. So I've just put that in the chat. Oh, there's a question from Kayla. Are there many medical writers that are not healthcare professionals? Yes, there are lots of medical writers that are not healthcare professionals. so even if you're not a healthcare professional, maybe you're a scientist, or maybe you're a student that's a journalist, or you're a creative writer, or you have an English literature degree or something like that, then yes, it is possible for you to get into medical writing, but the type of medical writing that you can get into might be quite limited unless you're going to learn those specific skills. So I would say creative medical writing or education medical writing is probably more accessible than regulatory medical writing, where it's a bit more technical and you really need to know about the statistics and analysis and evaluation. And that's probably not something that you would learn unless you do a science-based degree, like a Bachelor of Science or a Master of Science or a healthcare professional degree, or if you're doing PhDs as well. So PhDs do get more of the kind of technical writing jobs because they have those statistics and analysis skills. But don't let that put you off. There are lots of people who have masters who have got into technical writing and maybe even bachelors. So yeah. Could you please mention the name of books that you have told in the seminar, like the one to improve creative writing skills? Yes. So I think it's 50 Writing Tools by Roy Clark, and also Tom Albrighton, which is How to Write Clearly. I'll write down those names in the video description and also in the email. So I'm trying to keep a mental note of everything that you're asking me to send you. So I will send them, I promise, I'll send them. I'll also put them in the WhatsApp channel as well, because you're all going to follow that. So yeah, thank you so much, everyone, for being here today. This was meant to be an hour, it turned out almost 2 hours. So I think we had lots of fun. Thank you so much. It's been really nice to experience this whole thing with you guys. And yeah, I appreciate you offering to do some proofreading in case I feel overwhelmed. Thank you. That's really kind. I'll keep you posted for sure. Thank you, Rick. All right. Well, thank you, everyone. Thank you for all the love hearts and claps. I love this. This is definitely something new. I didn't have this last time. So, thank you. I'm going to screenshot this. I love it. Thank you so much. All right. I will catch you guys another time. Have a wonderful rest of your weekend. And I'm going to stop recording there. All right. Thank you so much. I'll keep you posted on opportunities as well. Thank you, Kayla. All right. Bye.